Turmeric, a fragrant yellow-rooted plant native to South India, also known as Indian saffron, used as a condiment in Indian cuisine, has become quite popular articles and is making its way up as major topic in major magazines and newspapers due to its various proven health benefits. Extensive scientific research on curcumin, the active ingredient of turmeric, and a naturally occurring molecule that helps kill cancer cells, and turmeric has demonstrated their potent antioxidant properties. Through their various mechanisms, turmeric shows promise as a means of reducing breast cancer. It is a natural insulin stimulant that can help people with type 2 diabetes. It is also effective against infection of cuts and open wounds. Turmeric also helps the heart. People with regular usage of turmeric had lowered their bad cholesterol and overall cholesterol. Now let us move on to answer the trending question regarding the recommended daily amount of turmeric one can take. In knowing the appropriate turmeric dosage to take on a daily basis, it is preferable to take it in moderation. The general approach is to start at a low dosage and increase bit by bit until you reach a dose that gives you results. General turmeric dosage information. When taking turmeric, some consideration must be included. It is important to choose a reliable manufacturer for turmeric supplements. Your pharmacist is a good source of information regarding the differences of manufacturers. It is a good idea to check first with your healthcare provider if you have any health problems and you are taking prescription medication as of the moment. Then your Murray recommends taken by itself 1 300 mg capsule at each meal or at 2 of 3 meals per day is sufficient. Combined with other herbs, anywhere from 50 mg to 150 mg is sufficient. Dr. Duke's recommendation on how to take it and how much is: I'm all for enjoying turmeric in fabulous food, one of the most palatable approaches to treating arthritis. For example, is with curries. As long as you really load onto turmeric. I like turmeric a lot, but I don't want to eat it every day. For most people, it's easiest to take the main active ingredient, curcumin. In supplements, I recommend taking 1,200 mg daily, divided into 3 doses. You can buy capsules that contain 400 to 450 mg. Dried root dose. Turmeric is commonly sold in the form of a dry, powdered root. The University of Maryland Medical Center states that any dose between 1.5 to 3 grams is appropriate for an average-sized adult. Standardized powder. The University of Maryland Medical Center recommends 1,200 to 1,800 mg of standardized powder daily. Turmeric tea. The National Institutes of Health recommend a half an ounce of turmeric root in 4 1/2 ounces of boiling hot water. This may be taken twice daily. Water-based extract. According to the University of Maryland Medical Center, 30 to 90 drops aqueous turmeric extract may provide medical benefits similar to dry powder or tea. Tincture. The University of Maryland Medical Center recommends 15 to 30 drops 4 times daily for an adult. Those with liver disease should avoid them because tinctures contain massive amounts of concentrated alcohol. Michael Murray recommends that turmeric should be consumed liberally in the diet. When specific medicinal effects are desired, higher doses of turmeric can be given or extracts of curcuma longa or curcumin can be used. The recommended dosage for curcumin as an anti-inflammatory is 400 to 600 mg 3 times per day. to achieve a similar amount of curcumin in the form of turmeric would require a dosage of 8,000 to 60,000 milligrams 3 times a day. Because the absorption of orally administered curcumin may be limited, curcumin is often formulated in conjunction with an equal amount of bromelain, which may possibly enhance absorption. In addition, bromelain also has significant anti-inflammatory effects, providing curcumin in a lipid base such as lecithin, fish oils, or essential fatty acids may also increase absorption. This combination is probably best absorbed when taken with meals. In general, most clinical trials use dosages between 250 mg to 500 mg of standardized turmeric taken up to 3 times daily. The general dose recommended for adults. Dosage: root. Recommended adult dose 1.5 to 2 grams daily. Powdered root 1 to 3 grams daily. Standardized powder curcumin 400 to 600 milligrams up to 3 times daily. Tincture 1:2, 15 to 30 drops up to 4 times daily. Liquid extract 1:1, 30 to 90 drops per day. Note that 1 gram is equivalent to 1,000 milligrams. Caution regarding turmeric doses. It may cause nausea if taken on an empty stomach. Turmeric lowers blood sugar and may be a problem for those who are diabetic taking diabetic medicine and hypoglycemic. Turmeric lowers blood pressure in high doses. If you will take high doses, stop at least a week when having a surgery because it is a blood thinner. High doses may stimulate uterine contractions and menstrual flow.